health condition.
And when someone in the Circle City needs immediate crisis help, IMPD patrol officers are usually the first and sometimes the only ones to respond.
Tonight, our Beer Shell Edmate learns the impact to Hoosiers in crisis and investigates why that responsibility still mostly falls to officers instead of clinicians.
Every crisis need and response is different, and several examples, including here in 2022. The parents of Herman Whitfield called 911 explaining he was, quote, having a psychosis. That crisis response ended when he died after officers tased and restrained him. Last August, Metro police officers saved this man who was suicidal, hanging off the South Emerson Avenue Bridge. IMPD safely brought him to Eskenazi Hospital. The same month, SWAT officers killed Kendall Gilbert, who family says was schizophrenic, after days of 911 calls about Gilbert's threats. And IMPD providing resources, his family called authorities again. IMPD shot and killed this man, who they say made repeated threats armed with a machete. Each case is different. Our investigation found what is the same is after years of city and state promises, officers are still mostly responsible for crisis help, not the clinicians Hoosiers need.
When we're in danger, we may call police. When we're sick, we probably call the doctor. But when there's a mental crisis, who should we call? It seems everyone agrees who shouldn't pick up the line.
You are exactly right. Police are not the answer. But unfortunately, in our community, in our world, in our country, we've come to rely on police for everything.
We're just really asking them not to respond in cases where we really need a mental health professional.
Unless there's a known crime or an allegation of crime, we should not be sending police officers now.
And mental health professionals have their opinions too.
So the clinician-led team is best suited. We also have the MCAT team that is responding currently.
Back in 2021, IMPD told me all officers are trained in mental health. But back then, we found only a small number had expert training. Then and now, Metro Police leaders also said they wanted clinicians to respond and officers to collaborate when necessary. After 3 months of investigating, I found today that responsibility still falls mostly to officers. They responded with treatment and emergency room detention nearly 8,000 times in the last 2 years.
Assistant Chief Bailey has said 80% of the IMPD's runs are mental health related. So you know these runs are happening in second and third shift. These runs are happening on the weekends. So we need resources out.
The resources are still limited when needed most, with mental health care shortages nationwide. Again, officers are tasked with filling the gap. IMPD doubled the MCAT unit to 9 officers who do respond with a clinician, but are not on duty when the calls happen most. MCAT is also less than 1% of the force. Meanwhile, there's the Crisis Intervention Training Program in Indianapolis. The 1-week, 40-hour mental health course is still voluntary and is not required by the Indiana Law Enforcement Academy or IMPD. Metro Police says the majority of their officers are CIT trained, but records I recently requested showed less than 40% of the entire force is CIT trained. That includes nearly 500 patrol officers who are often the first to respond to these scenes. IMPD declined to go on camera with me to discuss this topic, but did explain dispatch of a CIT officer is based on staffing availability and proximity. All officers have the minimum 8 hours of mental health and first aid training out of their 5 months of basic training.
They need to feel that if they call for a mental health crisis interventionist, that's what they're going to get.
The city just launched a 3-year pilot program to answer that call to action from mental health experts, law enforcement leaders, and advocates like Daryl Brooks with Faith in Indiana. Now IMPD partners, when needed, with a new 24/7 clinician-led crisis response team.
Really, they need somebody to talk to, and they want to be heard. They want to have somebody to be supportive and listen to them.
CLCR responds by itself only downtown, which is one of IMPD's top areas for calls. It's responded to nearly 150 calls since July.
So you have a compassionate group of individuals that are responding. They're trained with the crisis de-escalation, and they have a mental health background.
Behavioral Health Deputy Director and licensed counselor Julie Bingham says her team of 24 people uses clinical de-escalation tactics. Typically, a dispatcher has to either recognize a crisis caller or a caller has to request only a clinician response. That team then gets to work keeping a radio on hand to call for backup, which IMPD fully supports. So does Faith in Indiana.
As soon as it was implemented, there was a suicide call where they successfully intervened. I think that was a sign that this was the right move.
After the death of Herman Whitfield during a crisis call, Faith in Indiana renewed pressure for experts to handle these 911 calls.
We must do better.
Together with police and experts, these clergy leaders have worked to reimagine public safety and policing.
We're not asking for officers not to respond in cases where they are really needed. We're just really asking them not to respond in cases where we really need a mental health professional.
Which by all accounts is exactly what the key players think will best protect and serve Hoosiers. Reporting in Indianapolis, I'm Birshal Edmay.